So let's check in with someone who will have the answers to all of these questions for his weekly check-in. Mayor John Tory, good morning to you.
Hi, Mel. I'm not sure about all the answers, but I'll try my best.
We'll try. Okay, so I first want to begin here with encouraging news in tripling vaccinations for these hot zones. And we've seen those lineups. And it does. It speaks to people wanting to get the vaccinations, but the need as well. So how is this all going to play out? Can you talk about the numbers of vaccinations, number of doses that'll be put into each area?
Well, we're allocating 12,000 doses to these hotspot areas, 13 of them, and that's going to allow us to do a lot more, as you say, triple the capacity we have there now. And it's all hands on deck. So we're having, on the one hand, crews put together to put on these mobile clinics in the 13 hotspot zones over the next 2 weeks that consist of hospital partners, physicians, community organizations, and so on. And then we have a separate group of, as you mentioned, of firefighters and paramedics and others who are going to go around and get at some of the harder to get at spots, shelters, and places like this where we need to get people vaccinated because they're high at risk and they're in areas that have been hard hit in one way or another. And so it's that plus the city-operated clinics, which will continue to run. And the city-operated clinics, say the two in Scarborough, are each seeing in Malvern and Scarborough Town Centre a 25% increase in the number of appointments available because we have some modest increase in vaccine supply. All of this is governed by vaccine supply. And in the event we get even more than we're expecting, we can do even more. We have more capacity, but we're just governed mainly by issues of supply.
We are just looking at the numbers when it comes to vaccinations. So the latest numbers, 977,000, almost 900 vaccine doses have been administered here in the city. That is very encouraging to hear. I'm just getting this information now that Premier Doug Ford will be holding a virtual press conference. Again, that information just coming to us now at 9:45, and hopefully he'll be talking a little bit about sending vaccines where they need to go for an update there and so much more. We have not heard from him since Friday. Have you been in contact with the Premier?
Yes, I have. In fairness to him, I mean, he's been asked to isolate. And so, you know, isolation, I went through it. And it doesn't mean that you can't appear. He's going to appear at 9:45. But it does mean that you have to be staying home. So it's a little more difficult to appear. And he's been working away. I know that for a fact. He's been working away on different things that they're doing, including trying to make sure that the vaccine supply is both increased overall for Ontario, if we can do that, and also increased in the context of attention to hotspots. So, you know, in these jobs, you may be at home having to isolate, but you're not, you know, watching Netflix or watching sports on TV. He's busy.
There's a lot of work to be done. We're also waiting on more information when it comes to paid sick days. Toronto and Peel putting into place Section 22, saying workplaces 5 or more COVID cases will need to shut down. What are you looking ahead to when it comes to the possible paid sick days announcement from the province? What would you like to see?
Well, those two things you mentioned go together, because in the event either that you're going to see a workplace closed, or more likely that somebody is going to come to work with symptoms and be afraid to lose their paycheck. And I mean, this is something that we all have to fully understand, that there are people who, you know, if they got sick, wouldn't get any protection in that regard. And the existing federal program that is in place is there, but it takes a long time for people to get the cash in their pocket to feed their family. And the amount involved at $500 a week isn't going to replace the income of people, say, even in a lower minimum wage type job. And so what we're hoping that the province will do is to come forward with something that at least during the duration of the pandemic will make sure people have a wage that's going to allow them to feed their families and replace their income largely. And secondly, that is instantaneously accessible, so that people don't have to worry for 1 second about you know, where they're going to get the money to feed their family from if they are feeling sick, get sick, or test positive, because all of these things were encouraging people in effect to go to work sick, which is a bad thing, because then of course it spreads inside that workplace and could lead to the whole business being closed down and everybody being in a situation where they can't come to work, which is not something we want.
Mayor John Tory, we have run out of time. So much to discuss. We'll do this again next Thursday. Thank you.
Okay, for sure. Thanks a lot.
All right, 7:10 is your time right now. Before we go to Dina and Sid, just a reminder, this just coming out, Premier Ford will be holding a virtual press conference at 9:45 today. CityNews.ca will be holding that one. Ask and you shall receive, Sid and Dee.
I think Sid did it, Sid. I think he heard you.
Please, don't make this about me. I always get uncomfortable when that happens.